is right. Scottsdale Center for Women's Health. Dr. Webb and Dr. Bartels. And Dr. Webb joins us once again. How you doing, Doc?
Dave, we're doing great. Thank you.
Good. I got to tell you, everywhere I go, it seems like people know you. So I went to get my physical yesterday. I'm sitting in the lobby. I open up a magazine, and there you are, you and Dr. Bartels. So I go in for my appointment, and the assistant said, I know Dr. Bartels. Saw him on the show. I said, well, that's great. Awesome. Doctor comes in. He goes, hey, I know Dr. Webb. Tell him I said hi. I'm like, what? And then I go home, and my wife said, hey, my thyroid issue, I think I'm going to go see Dr. Webb. Would you let him know? What am I now, your assistant? Am I booking patients for you now? Yep. Is that what I'm doing?
We're doing a lot of really neat things that I think are getting some attention.
Yeah.
I was in the locker room at the gym, and guys are all there looking at their muscles, and of course I'm not because I don't have very many muscles. And so I was, toweling off, and a guy comes up to me and says, hey, you're Burt Webb. And I go, yeah. And I wasn't sure if it was someone, going to arrest me or what. And so I was a little hesitant. And he said, my wife is having this problem. He starts talking about his wife's problem.
At the gym?
In the men's locker room.
In the men's locker room. And, but it's good in a way because the things that we're doing are beyond what anyone else is really doing.
Yeah.
Some neat regenerative ideas, really the most advanced ideas. You can go a lot of places and get some simple things. We're doing just some great things that are really improving the quality of women's lives, as well as men. But as far as the women, they're simple things that they can come in, we evaluate them. They don't have to give up their OBGYN that they've had that's delivered their babies.
Right.
They can come in, they're not feeling well, their libido is low, they may have problems with, I can't say vagina, I'll say V.
Under the belt.
Yeah.
Under the belt, thank you. And there's some really simple things that we can do that they want to do, but they're hesitant to talk to anyone about.
Yeah, and it's a really good thing that guys are becoming more publicly aware about women's issues, as well as their own, but it's good that they're talking about it. That means that we're going in the right direction. Let's talk about some of those under-the-belt procedures that you do. The three that we've talked about in the past, I want you to go over those again because one of these is probably something that our viewers will be interested in. Let's talk about the O-shot.
O-shot is awesome. So what it is, it's taking the person's own blood, and then we separate out the factors that are the healing factors, and we put that back into the patient below the belt. There's no pain involved. It's all done within 30 minutes. Someone can do it on a lunch break, and it rejuvenates all that area down there so that things are just more youthful.
Yeah, with all these procedures we're talking about, including the O-shot, what Dr. Webb said, 30 minutes and you're out. There's no recovery time.
Right.
And then get right back to work. So it's all outpatient stuff.
And we have the most advanced. There's a lot of, pieces of equipment out there, and a lot of people are offering it, but we have the most advanced equipment to get the highest amount of, I'll say, factors that are healing factors and regenerate really nerve tissues and tissues that are down there.
Three procedures we definitely want to talk about. We covered the O-shot. Let's talk about the Genevieve.
Genevieve is something no one's heard about because we have one of 5 pieces of equipment in the United States that is incredible for treating bladder leaking, rejuvenating the tissues around the clitoris, and tightening the vagina. So there are pieces of equipment out there, and people talk about tightening the vagina, but this is the ultimate piece. The other one, the third one that you mentioned, is the FemiLift.
Yeah.
And that's a great one at just making that whole area a little bit tighter, healthier, more moisture. So there's a lot of women that will use this on, and I brought this little paper here. One of the big things I'm doing is helping women that have had cancers or breast cancers and can't take estrogens. So they're below the belt, it gets to be less healthy. And this is a really important part for a lot of women, for any woman, but especially for someone that's had breast cancer, can't take hormones. They want to get back to being normal. All women want to feel as good as they can. And in our office, we'll do it we'll evaluate their hormones, we'll evaluate their bottom, and tell them what they can and can't do. But the Genevieve is really a great tool. There's no pain. It takes about 25 minutes. It's very simple. They walk in, they have it done, they're gone.
Do most women realize that there's even an option other than taking estrogen after they have breast cancer and cancer surgeries?
No, that's a great question, and most women don't realize. Most women, I see women all the time that come in and say, I don't enjoy intercourse. They don't tell me that. It's just through talking with them. They come up with that, and they say, I never have, or the last year it's been bothering me, and I'll evaluate them. I'll say, well, you could do this. And they'll say, I've never heard of that before. And it's simple little things.
That's why you want to go see Dr. Webb and Dr. Bartels. All right, it's ScottsdaleWomen'sHealth.com. Nice and convenient in Scottsdale. Basically, it's about Via Dave Ventura and team, or Dr. Webb and Dr. Bartels. Thank you, Doc.
Thank you, Dave.